the target and
Okay, my friends and my panelists, ours is considered to be a holy profession. Once upon a time, we are revered as equal to gods, Vaidyo, Narayano, Hari. From there, why you have slipped down rather to our own doctor, Dr. B.C. Rai, once he told, Vaidya Raja Namastubhyam, Swam Yamadamma Sahodaraha, Yamato Harti Pranani, Tvam Pranani Dhanani Cha. So we have slipped down to such level. What made our profession to go back to that day? As a result of this, once a revered profession, now he is getting big bags instead of getting flower bouquets. So a lot of attacks are occurring on the doctors personally or to the establishments, hospitals in general. And not only here, it is there everywhere in the entire world. This is what I am quoting from JAMA 1891. In those days also, America faced the same problem. So also everywhere. So we call it as workplace violence because of the zero tolerance for the human errors by the patients. So society's expectations have changed. 100 years back in India, doctor's word means it is Bhagwan Bhuvacha. Now doctor's word means it is next to Google only. Google is the Bhagwan first, then comes the doctor. So why so much change? Why the sea change in the community? Why a lot of atrocities? Why people are throwing stones on us, on our establishments, are scolding us, physically abusing us? So there are a lot of things occurring everywhere. Every day in general, every day one incident occurring in the country. And every state is facing this, every taluk is facing this. So why? What are the reasons? Any reasons from our profession side? Or reasons from the patient side? Or reasons from the government side? It is wrong. So in order to know all these things, now today we have a panel discussion so that we can know what are all the remedial measures to be taken in to curb this violence on the doctors. So every city, as I told you, every city in India is having these problems. Verbal attacks, physical attacks, destroying the properties. And today we are in such a situation, if any parent wants to, Baba, what do you want to become when you become an elder? See, the youth is telling now, I want to become anything other than doctor. So the such a critical situation where we are facing, this holy profession is facing today. In order to know more about this, now once again a big round of applause for all our panelists. The question now, we will take the opinion of the panelists. Why attacks are increasing every year? Your views, three of you. Your views.
Yeah, I'm Dr. Rajan Sancheti, and every, I would say, day or so, we have a lot of, I would say, calls also that there is some issue. What happened? That the patient died and they wanted to discharge the patient without anything. They were not interested to pay, and a lot of things happened. They were already explained the charges, and in spite of that, they were not ready to pay. That they took the doctors responsible. Day in and out. What happens? They actually beg. You just admit our patient, whatever the thing we are ready to pay, it might be ICU charges, whatever. And in spite of that, the attacks increase. Why? Because patients have become very impatient, I tell you, and because of that, we are facing this thing. Maybe lack of communication between the doctors and maybe the patient's relative. No one takes for granted that death is there. That is the main cause that they should understand. अभी आए हैं, जाना तो है, अमर नहीं है. You are not immortal. Yes, suppose subject, so definitely lot of things can happen. And main thing, why it is increasing? Because in and out, newspaper, media, we see on the right from the newspaper, whatever is there, digital media, they are harping a lot of their negativity, I would say. Because of the negativity, some doctor, death has happened and doctor has committed crime. That is a big issue because they held doctor as a responsible person leading to the cause of death. Lot of things I would say transplant happened. Doctors they feel they are like criminals and they take it for any depth of the thing and that creates I would say a lot of impact even in the rural areas. That is a big problem that patients are shifted in the ambulance and the ambulance come late. It might be some reason that the driver is not available, there was an accident, lot of things happen. And again when the ambulance is not available, they try to create, I would say, chaos. And when it reaches, there is no doctor available. And because of that, a lot of hospitals, they feel immediate attention should be given and it is done. Some way or the other, there is a problem of, I would say, now we have heard the cases of incubator death of babies and there was some short circuit. What happened in Ahmednagar? The short circuit because of that incubator and the baby infant died. And because of that, they held the doctor responsible. This is, I would say, really an amazing thing and very serious and a toxic thing that they are, I mean, taking it granted that the doctor is responsible for the electricity also. And whatever the equipments and other things are there, because of that, it happened. Actually, that lady had, I would say, she was trying to save the patients. Unfortunately, the infant died. There was fault because of the electricity. Actually, they should have taken to the task. The collector should have advised the inquiry what happened exactly, why the fire was there, and because of short circuit, they should have held the responsible of the department who is concerned with the electricity. But they held the doctor responsible, and it was an unfortunate incident that the doctor was confined. She had been put to jail. Now, yesterday also I had a call that one of the junior doctor, some patient wanted discharge, he was discharged, and I think there was some, I don't know exactly all the story I couldn't hear, but there was a call from Aurangabad that sir, one of my brother-in-law, he is a junior doctor. Now see, he is learning. Junior doctor doesn't know a lot of things and he, what happens, no, medical legal things, all the things should be documented. Because of documentation, what happens, he didn't document or exactly what thing happened, I don't know. But because of that, the junior doctor is still in jail. And it is shocking that he couldn't get the bail. Now again the lawyer was changed, they will go for a second accusation, they will go for court and request the court that this thing, actually the commissioner of police, he said that the guy is innocent, he is learning. Somehow the police station, the police in charge, police inspector, didn't know what happens, they don't know much of law. And whatever the things, they said they put the charge of kidnapping, sir. And that was really shocking. And junior doctor, how can he kidnap? And the patient went off. The patient sometimes is absconded. And because of that, the doctor should not be held responsible. I think a lot of things should come into picture, and I would say the increasing things is because of lack of, I would say, knowledge of the police department. So they should also be briefed. Now that in Pune, we had gone to commissioner and our commissioner, Mr. Amitesh Kumar, had put on the circular to all the police stations. In spite of that, the thing happened. He just put on the circular, whatever things, whatever the violence, you should take strict action and see that the doctor is supported. So I think the lack of communication between the society, all of, I would say, public, press, police department, they are, I would say, they should be aware, they should be made aware of the law, and because of that, I think we can have some at least situations, the tricky situations can be curbed. So I request other doctor, whatever he feels about the increasing attacks, I have a lot of things. What IPC, I talk that later.
Thank you so much. At the outset, let me thank on behalf of Maharashtra State Chapter of the ASI for inviting me to this wonderful conference. Just a word about this particular session. I guess this is out of your entire
Out of syllabus.
Yeah, out of syllabus. So that's why people are there in that next hall. So talking on this particular slide, as you are,
This will become syllabus once sexology gets appeared. That's why included in advance.
actually, but it by now it must have got that much amount of fame. Right? This is the 40th conference.
Yes, but yeah.
So that's 40 years at least.
Yes.
So, anyway, so you were saying in that slide that no child or no young man wants to become a doctor. I am a professor at a medical college, and let me tell you, the situation is not that great. Unless you see how many students are appearing for NEET exams, they are in lakhs for very, say, few thousand seats. So it's not very gloomy. People are still, after this Nobel profession, it is still a Nobel profession. Now, when we analyze or try to think about why there are more attacks on doctors, I think we need to divide this into two aspects. One is attack on doctors community, but the second is we must think about the overall community as such. There are things which have changed the communities. One is economical status. I think previously there was poverty to a larger extent. Today we do not have poverty. I would tell you there are so many malls, and if you go to malls, people are there buying, purchasing everything, every other thing which is kept there. So they have got money. Second, literacy. People were illiterate, they were not knowing what is going on. So whatever Vaidyanatha says, okay, Bhagwan ne bata. Today is an year. Today we have literate guys, we have communication media like Google, which gives you half knowledge. So at our places they used to call Nim Hakim Khatre Jaan. So they know half, but they do not know what exactly is happening. So change in economy, change in literacy, change in the overall scenario at large has caused. See, if you open newspaper any day, you will come across hundreds of news which are because of petty reasons there are quarrels. Like somebody is overtaken, there is a road rage. Right? So this is what I believe is the prime source of more attacks everywhere.
Come, please. Great.
Good evening.
That is Dr. Madan Kamble. He is a very active member of the POGS and AMOGS.
I practice in psychiatry and violence, aggression, and handling doctors also who have faced violence and aggression. So I have seen the both sides, violence and aggression in patients, and the doctors who have handled violence and aggression, and then they are traumatized and then they have come to me. So what I feel, increasing chance of violence currently in current scenario, mostly it's because of trust factor. Earlier, doctor was trusted a lot. Currently, doctors are not trusted at that part. Every time a patient comes, he sees us through a lens. Majority in city like Pune, there are corporate hospitals where the doctors are employees, and at the end, the doctor becomes a soft target for everything that has been mishandled in the institution. So in current scenario, communication skills are the only solution to decrease violence in the
But the question posed was, why attacks on
your view? Your specialty view.
As the sir rightly said, poor communication and disturbed relation or doctor-patient relationship. I think a remedy for this is this should be started from. Okay.
So the observations here from the all of it, IMA, surgical branch, psychological branch, psychiatry, and obstetric branch is one, increasing paying capacity. People are thinking that we are paying, our patient should survive. If not survive, then it's the fault of the doctor. One. Two, they are ignorant in those days. That's why Bhagavan Vacha, now they are, Google has made them more intelligent than the doctors. So they think that we are all not up to their mark. Three, this is a valid point, trust has breached between the doctor and patient. Maybe various reasons. The fourth one is, apart from all these things, the relationship has been changed. Now, recently, till BNS, Bharatiya Nyaya Samhita has come. Before that, it was IPC, Indian Penal Code. So, in Indian Penal Code, doctors will come into the section 304A, where negligence still actually come. When British rule has come, in the British rule only this was formed. In those days also, they never mentioned about doctors. They mentioned about anybody doing negligent act. They will come into that law where they are punishable either by imprisonment or by fine or by both. Never doctor was a party. Once it is replaced by BNS, section 106, our Indian government, present government, has clearly indicated doctors as a party. Previously, 304A, doctors was never a party. In general, here clearly mentioned that doctors at the same time, when 304A was there, courts have a liberty to give some margin to the doctor because they can say, pay fine, go. Then, unless it is a very gross negligence, then put him into the bar. Otherwise, most of the times, a warning or pay and go. Now, the courts also cannot do anything under BNS. Doctors are clearly indicated at the same time, jail and fine, both are included, not R. R is removed by and. So, for this, how we are fighting, we are retaliating. We are retaliating it. Please, your opinion, sir. So, this is the government side doing injustice to us.
Yeah. So this is quite injustice on the part of doctors, because right from British, they knew what doctor is. Now, unfortunately, we support the politicians, they come for the voting, we vote them, they need votes because each doctor has, I would say, in the constituency more than 1 lakh patients, maybe or more. And if that doctors protest, he remove this. So the change in the law should be made, and it was okay, but they should be added that actually when there is a grievous, as you said, sir, if there is a grievous injury or if the doctor has overlooked or there might be some fault which could not be have taken place, then I would say that doctor should not be held responsible in any way. First thing, we should emphasize and tell the politicians, doctor actually tries to save life. That is the main thing. He does not do any under intention to create death to a patient. Each and every person who becomes doctor, we have taken oath, Hippocratic oath. And definitely what we do, we try to save whatever. It might be a disaster management, it might be a surgery. And what happens if the surgeon is under heavy stress of these laws? Who will operate? Government should realize that whatever, I think one judge has given judgment that this is, he has, I mean, withheld the statement, and whatever the, I think punishment was given, the judge said that this is wrong. Actually, doctors, we should treat in such a way, he should be stress free to operate, or maybe it is, if he is in ICU, to treat the case. So, this penalty, whatever is given, this is total injustice on doctor fraternity, and this should be changed. We can have some other things also. Doctors are always,
We should now protest this and
protest this, and we try to remove this. This only I can say. Please.
I think yes, it has to be collectively done at the national levels with IMA, surgical branches, gynae branches, and all the fraternities as such. So unless it is a collective effort, nobody is going to listen to this. Sir was rightly saying we do have a large patient database, but how many times do we call patients and ask them, "Kya re bhai isko vote karo?" And they will never listen to us. So we were never in that seat. We never convinced anybody to vote for anyone. We were never political at the start, I would say. And that is the reason why no politician pay heeds to our demands. So unless we unite, we can't change.
Sir, even why government, police, press are not serious about this?
Sir, politicians are never friendly for doctors. They are always, politicians have a people-pleasing attitude. And the current sentiments of people are against doctors. So they are not going to change this. It's been in act, so we need to accept this reality. Even protesting is not going to help. United strength only can save us. We can't change the rest.
Your take, sir.
This again disturb a relationship between our fraternity, and again the point of trust is there in the general community.
Anybody wants to add?
Sir, I do feel that the central body of the Indian Medical Association has sent its recommendations to the Home Minister for changes in the BNS,
Yes.
wherein they have said that doctors do not fall under the criminal purview, but it is still under consideration. It is still under consideration. They have not yet removed it, but
Under consideration for the last 1 year it is there.
correct, correct. So they have been, the movement is on. IMA is not sitting silent on it.
But general consensus wise, if you see, government and NMC for that matter, they do ask our opinion, but they do what they want.
No, but IMA has been able to change a few, especially at least in Maharashtra. We have yet swatted away the Maharashtra Clinical Establishment Act as yet in Maharashtra.
Sir, recent case in Satara last year.
Yeah, day before yesterday one incident happened in Maharashtra. Day before yesterday.
There was 304A. High Court demanded, High Court applied, why not 302? And actually it was done by High Court, not demanded by. How the scenario is changing. And they were behind the bars under 302.
304A should be what has to be.
Yes, that was more appropriate by a professional, any professional. 302 is culpable.
Yes.
It becomes a serious offense.
Amounting to murder, yes.
Serious.
Non-will.
Coming to the reasons why these attacks are occurring, already discussed for
Already discussed.
communication gaps, delay in medical attention, denial of admission, among the other factors. Because most of the times, our junior residents, first year PGs, house surgeons, junior residents will pray for all these attacks because they are the first four soldiers. They will be there, and the emergency department, casualty, wherever. So where these people, they don't know the mindset of the society, mindset of the people who are there on the opposite side. They will say, no, beds are not there, beds are full, go tomorrow. No. So that will irritate these patients. This man is busy in suturing in the emergency department with a laceration. That fellow is waiting with a scarf and bag or swollen limb. And how much time you are taking? We have 1 hour over. I am sitting here for 1 hour. Nobody is coming. So that fellow is losing his patience. So such situations are the common things.
That's why juniors has to be educated in this regard, how to tackle this situation. So that is one area.
One story I would like to tell. At one, as you said, one surgeon was operating a patient, and he heard that his son had died in an accident, right? And the people were outside. They were total, devastating situation, and said how much time this doctor is taking. And he total completed the operating, the patient was saved. And he told later, it is okay, what has happened, we have done our best for the patient. And some authority from the hospital told that sir's son has died, and because of that, he didn't go, he first attended, did his surgery calmly. And all the who were there, they were shocked. So such stories, you said that journalists are always negative on the part of doctors.
They want to
So that is correct. But what happens now? We should create awareness amongst them. Now what we do at Pune IMA or many of the IMA, we take health camps in police department, we take camps in for journalists, even just a medical representative, other faculty. So what we should do, whatever the police station is nearby, each and every doctor has police station constituted of many people. So what they should have a good impact on that police thana, so that whatever the thing is that, they will also come into picture. I think we will go for that also. So that will be the best. So whatever the things are there from our side, we should do it. Now see the scenario also. We say we are united. Sorry to say, when this hall is full, everywhere there is the same problem, that we don't have many of the doctors attending or voting. And if the scenario changes, most of the doctors, if they go in for politics, definitely many will win in politics. Then we can have some good stand, and the politician will also realize that will be a blow to them. If you listen to doctors, okay. Otherwise, we will be definitely defeated. So such scenario should be there. So please.
more things. Yes, sir.
Mismatch in the expectation and the results.
Sir.
लोग इतना एक्सपेक्ट कर रहे हैं, पॉजिटिव एक्सपेक्ट कर रहे हैं, they don't tolerate the negative result, and that is less tolerance by the society. That is also one of the.
Sir, may I have a question?
Absolutely.
Looking at that data that you have asked, just one question: why are there more attacks on public hospitals and delivery hospitals or gynecological hospitals, apart from private practitioners or small hospitals?
Even I will give an example. Currently, the ICU beds in Dinana, Ruby Hall, they are full. So whenever a patient goes to these hospitals, they say we can't admit this patient because it's full, and please take this patient to another hospital. So however influential that person is, he has to take that ambulance to another hospital. But will it happen the same in Sachin hospital?
Government hospitals are overworked.
So they are overburdened, and they will have to admit all the cases.
Soft targets.
So every case which is not handled by private hospitals, or currently doctors are becoming very guarded. They are going to refer it to another hospital wherever they feel they are not.
One way I am happy, the private sector is guarded. When they are sensing something wrong, better throw on the government. One way happy. One way I am not happy. Everything is coming onto the doctor's head. There is the government hospitals. The juniors are coming to it.
Yes.
There's another.
As far as the obstetrics is concerned, it is very sensitive issue for society.
Yes.
There is question of life of mother and the baby. If something goes wrong, they immediately react in a harsh way. And I think as far as the litigations are concerned, I think around 50% are obstetricians under CPA.
Opticians and even the general hospitals, medical people, surgery. Now, how we are all should be trained how to deliver bad news. So how our views
I get this.
Unfortunate things happen. First thing, who reacts. A junior doctor is there. So we have to train the junior doctor. Whatever has we have seen in the movies also. हम लोगों ने बहुत कोशिश की. बाकी तो सब ऊपर वाले के हाथ में है. It depends on God. We have tried our best. Just whatever the news we have to. Sometimes it is a political leader to break the news. That is, I would say, really tricky job. And junior doctor is there. It's very difficult. So we have to have a spokesperson of the hospital. All very well trained by a psychiatrist, so that we call it behavioral science, or maybe whatever the mob is, he should learn how to deal or how to tactfully tell them. So if we breaking the news, I would say very tight corner situation is there. We have to tell it. Whatever the efforts we have done, all whatever second opinion we have taken, everything has been taken. But ये तो खुदा की मर्जी है. अभी हम लोग कुछ नहीं कर सकते. It is a Muslim. Whatever the patient's caste is, I don't believe in anything. But whatever the thing, if the person goes there and tell them, what happens sometimes? A community leader is there. Catch hold of him. Tell him, भाई आप इनको बताओ. हम लोगों ने बहुत कोशिश की. ये नहीं बचा सके इसको. या तो if any of the caste, whatever the leader is, call him first. Tell him how to break the news. Leave it to him. What happens? He will take it nicely. He also knows the doctor has taken great efforts. Sometimes, whatever, if the leader is, something happened, I think in Mumbai also, total hospital was burned. After that, I think it was Reliance or some hospital, I don't know the name. But after that, he will take the hospital. It was left in that way. That is very bad on the part of society, that the hospital burned, and definitely no one will be treated.
I think many hospitals left the practice of hospital. Now they are real estate, doing real estate.
Doctors have also left practice, unfortunately. You are correct, sir. So please.
As per my opinion, this news should be disclosed in closed premises, for example, in OPD under there is CCTV. And first of all, we should call our 2-3 senior friends, consultants from our city. And this should be declared by the in charge of the hospital or the treating main consultant with the close relatives, not the mob person.
The problem here is our patient attendance morning one attendant will come, afternoon one attendant will come, evening another fellow will come. This evening fellow will be asking the duty doctor, "Kaisa hai sir?" This evening duty doctor is not the primary consultant for that patient. He has gone there to see other cases in the ICU coming out. This fellow is asking, "Doctor साहब हमारा कैसा? सब ठीक है, सब ठीक है." बात है. This fellow thinks yes, सब ठीक है. Next day morning, the real primary consultant will come and say that a renal shutdown has come, electrolyte imbalance is there, he is in a danger. क्या बात कर रहे हैं danger? कल रात को वो डॉक्टर साहब बोले अच्छा है. अब कैसे होगा? So this misinformation makes the people angry and speak about against that. So that we should develop, as rightly said, one spokesperson for emergency department, for ICU, for maternity ward, for outside theatre. He is the only person responsible. Otherwise,
exactly that is not happening in government institutions, and that is the reason why.
That should happen so that he is the one who should be a spokesperson. These incidents will come down.
Sir, sorry to interject. One question.
Yeah, absolutely.
Can we make out hostile patients?
Absolutely.
So,
Yes.
pointers of how to make out hostile patients.
That question is there already. There is slides. So these are all the various ways of breaking the news.
And one suggestion. Actually, Dr. Madan Kamble is in private practice, but the referring doctor, a person who is known to that community, should always be involved while breaking the news. That's my suggestion.
Absolutely. Absolutely. Because that will have a positive effect on the
person who is basically having some influence on the entire.
Yeah. The referring doctor, if he is involved, is always better.
But actually, see,
The patient is really bad and everything has been already told to the relatives and everything is communicated well, nothing happens. Problem comes when unexpected deaths happen. That is where the problem comes of getting there.
False promises we give, usually doctors will be more, कुछ नहीं होता, सब ठीक हो जाता. Because with the good faith, we will be telling these words. Sometimes they will revert back.
Now we are not.
They will revert back sometimes. So what are the punishments that are now as on today, the punishments for these culprits in India?
Existing laws, I will say, Indian Penal Code, IPC Section 1525, voluntary causing grievous imprisonment up to 7 years. IPC Section 307, attempt to murder, imprisonment up to 10 years. IPC Section 353, assault or use of criminal force on public servant, imprisonment up to 3 years. Doctors Protection Act 2013, that is varies by state, provide protection to doctors. Now, what we suggest the enhancement, increase of imprisonment terms for violent crimes against healthcare professionals, just like as happened for Momita in Calcutta at Car Hospital. It was really unfortunate incidents, and we really, I say, we already condemned, and government of Bengal, they should take strict action. We heard that they will be hanged, but it should happen very fast. It should be a fast track court. Then definitely something goes to the society, and in hospitals also, they should have one board also. Whatever the things are against, they are doing for doctors. So these are the act, so that at least they will take the cognizance that this is difficult now. Whatever they are doing, they will be under bars. Secondly, introduce specific laws addressing violence against healthcare workers also. Implement stricter penalties for repeated offenders. They should not be let out. Mandatory psychological evaluation and counseling for perpetrators. Compensation for victims and their families should be done.
So many laws are there.
Yeah.
At least one party is punished till now in India.
No, that's the problem.
They'll go to the police station, from there go to the home.
Next, whistleblowers protection for healthcare professional reporting the
And
violence.
most important, what about recovery of the damage of the hospital? It's not possible.
Only if you have insurance will fellow will pay partly.
Double the amount of.
Double the amount is there, but recovery?
No recovery.
Next one, journalist told me, we have a registry. How many violence has been done?
Yeah.
And national registry for tracking violence against the healthcare violence. It should be there for each and every hospital, and it should be given to the headquarters so that we can put it before all of the parliament, such and such things are happening. And next, it should be shared also. Whatever has happened and who are the other culprits, they should not be treated. I don't know how can it happen, but we should also have a blacklist of patients, relatives and other things.
What I feel about is our doctors have a lot of tolerance to violence. So they don't go to the right levels to fight their case. We don't have time, we don't have patience, and we don't have tolerance. So incidents happens, doctor is traumatized, he reports it, but he will never follow it. He will never follow that case, he will never follow that the culprit is being punished. So that tolerance has led no punishments.
Sir, this question, since we are running like probably last question, can doctors refuse to treat violent patients?
Yes.
I think doctors can refuse to treat patients under circumstances. Like emergent cases, you cannot refuse. But apart from that, if the patients are, the condition is not emergent and you suspect self-injury, so in case of self-protection, I can refuse to treat. If I feel that the patient can cause harm to my colleagues or the hospital staff, then also you can refuse the patient. So except emergency, you have a right to say no to the patient.
But when you say no, to escape the law, always say we don't have facilities to tackle this issue. Yes, referring to the next center.
How to put it in words is different.
Right.
Actually, it is true. We cannot refuse emergency cases, emergency patients. And also, if you are refusing patients, a referral letter has to be given to them.
Yeah, absolutely. Yes, we have a choice. We can choose a patient in that way. Emergency is an exception. In emergency, we have to treat that patient. We can choose a patient. When we sense that there is a trouble from that party patient, intelligently we can escape and send it to the other party. Now, coming to this end of the thing, to conclude, we strongly telling, doctors community, we are strongly telling, our plea is not to, don't intend to protect negligent doctors. Yes, few doctors are there in the profession who are negligent. We are not protecting them. They can be made appear to appropriate platforms. But at the same time, we cannot accept vandalism or any kind against the doctors, hospitals, hospital staff, admitted patient and established. So this is the conclusion. So the culprits must be punished with the non-bailable offences, and crime should be non-compoundable. Violence against doctors always jeopardizes the patient care and safety. Hence, my friends, from our medical side, from our side, collectively, communication, documentation. These two we are weak. Of late we are now learning, we are weak, so we should become strong. Communicate, document. Then document the communication. Then communicate the documentation. So these 4 lines are very important to reduce violences against the doctors. With this, at the same time, I am quoting the Supreme Court judgment of 2022 December, saying that medical malpractice is not always the cause of every death connected to the hospital. Supreme Court observation. So courts are little bit favorable to the doctors.
Yes, yes.
They are examining a favorable. So with this, I am closing the session. Thank you for all the participants.
I think very positive note to conclude the panel discussion on violence against doctors. I would request Venkata Ramana sir, our chairman of the CSEPI, to please felicitate our panelists with the medal and a memento. May I request Dr. Pratap also to please assist Dr. Ramana, Venkata Ramana. थोड़ा सा पुढे असं लागेल. Round of applause for Dr. Sancheti.
एक सेकंड सर. ओके.
Dr. Sachin sir. Dr. Sachin Naik. Very nice inputs from everybody. Dr. Pokle, please. Dr. Pokle. And last but not the least, Dr. Madan Kamble, most dynamic member of the organizing committee of the उनका नहीं है. एक दे दें. And Dr. Venkata Ramana needs no introduction, but we all know that he's a Karta Dharta of CSEPI. So if we have a medal. Thank you, Dr. Pratap. I think let's join us for the inauguration. I think very timely, exactly 4:30 we have finished.